So when it comes to feeding the older horse, one of the most important things to think about is their dentition. Hard to sort of imagine what goes on inside, but when a horse takes a bite of like hay or haylage, the only thing that shortens those fibre particles as they pass through the body is the teeth. Nothing else does it. And so the fibre particles, they have to be short, they have to be broken down in order that the enzymes and then the bacteria in the hindgut can release the most nutrients from them. So you've got to have good teeth. And as teeth start to fail, you need to adapt the feeding to mirror that. So signs you could look out for as an owner that the dentition could be failing is things like your horse starting to quit, maybe they're mouthing a lot more as they eat, or food packing in the cheeks, perhaps a foul smell. And in advanced dental disease, you may even see things like nasal discharge. But you can also look at the horse's droppings, and that's a lovely simple way to check how their teeth are doing, because fibre particles, when a horse has got lovely healthy teeth, they're about yay big, if not smaller. So look at them. If you've got long fibre particles in your horse's droppings, that shows there's a problem at the front end. Another thing horses may do as their teeth begin to fail, they pass a gorgeous normal dropping, but it's followed by a liquidy sort of jus or gravy. And you'll often see that staining along their bottom cheeks or just on the tops of their hocks. So again, that could indicate a dental issue. So do get your dentist in or your veterinary surgeon in on a regular basis to check the teeth. Many older horses need dentals every 6 months, and get them to give you feedback. Have they got lots of lovely enamel grinding surfaces left, or are they all wearing out? Is the horse becoming smooth-mouthed? Or are there loose teeth, missing teeth, or anything else that could cause pain and decrease the horse's ability to chew? Once you've got a full assessment of how much dentition you have and how effective it is, you can then decide on feeding. So older horses may suddenly start to lose weight when in actual fact, you're presenting them with lots of wonderful long fibre, they just can't digest it properly. So at that stage, you need to start adding in gradually fibre replacers. There are many fibre replacers, some of which are in a pellet form that you can feed dry, others have to be soaked to make a mash. But whatever you choose, there's many flavourful products out there, so you will be able to find something your older horse loves. Now initially, and I recommend regularly doing body condition scoring or weighbridge if you've got the luxury of one, you might only need to add in 1 or 2 small feeds a day of your forage replacer, and you can continue to use your hay or haylage as well. But over the course of time, as the teeth deteriorate, more and more reliance will have to be on these high fibre products. But there's plenty available that you can help your horse look well into very old age. And do bear in mind you're trying to mimic trickle feeding. So the more you swap over to these fibre replacers, if you can divide the feeds up and feed them at multiple times during the day, it's a real plus for the horse. And if you're not available 24/7, ask other friends on the yard if they can do some of the feeds for you.